In general, having clinical exposure is extremely actually unhelpful when it comes to preparing, especially for your first year OSCEs, I think as well for your second year OSCEs. It's not until third and fourth year where you actually need to be able to see signs of a sick patient that it becomes useful. In your first and second year, it's just about performing an act. You're going to hear that many, many times. It's just an act, you learn a script, you go through the steps, you try to do it professionally and think on your toes, but all in all, you will rehearse this so many times that it becomes second nature to you. You don't need to see patients on the wards. That's not the best way to prepare, especially in your first and second year. So what I recommend is practicing with students. Students are going to know the examination you're trying to do, so they'll know how to move quickly and appropriately to do that, as well as if you're taking a history, they're going to know how to give the information that you're looking for, as well as sometimes how to make it a little bit difficult for you and even ask some questions at the end that would be realistic. Now you might be thinking, well, when I do the OSCE, it's not going to be a medical student sitting there. I should learn to practice on people that aren't familiar with what I'm trying to do. Which is true, you won't have a medical student, but you're going to have someone that's familiar with what you need to do. The person that's sitting there is going to have a script, or they will have done this examination with a bunch of different students before you or the year before, so they're going to be very familiar with how to move and what you're asking them to do usually. In addition to this, you actually learn a lot of information by being the person examined or being the person giving a history. You start to form way more connections in your head that solidify these different techniques than if you're just trying to perform on the spot with a patient that you're unfamiliar with. Further to that, I recommend actually doing this in groups of 3. So you'll have one person that's being the student, that's either doing the examination, the history, the procedure, whatever it is. You'll have one person that's the patient, and then you'll have one person that's examining. This is extremely useful because the person acting as the patient might not be able to keep track of all the things you've asked or done quite as well as somebody that's sitting back and just watching. Even if you're the patient, and especially if you're the examiner, sometimes being able to watch somebody else do the techniques is really helpful for ingraining it in your mind. If you don't have access to other students, you can start off preparing by just listing through the steps in front of a mirror, so you get that pressure of somebody kind of looking at you and trying to maintain eye contact. Then try to move on to actually physically going through the motions, whether that's writing things down for a history or doing the examination on a pillow if you don't have an animal that you can practice on. My next big tips are time constraints. So figure out the timing of your OSCEs and then try and stick to that. I always say that when you're preparing for something, whether it's interviews or whether it's OSCEs, that you give yourself a little extra time to begin with, but then you really bring it down and make sure that you can perform within that amount of time. Some of the techniques that you're going to have to do will take up the full time because there's so many steps in them. Some of them you'll be done in just a few minutes and wonder if you've missed something because it's actually quite a short examination. My next top advice is repetition, and this doesn't mean just doing it many times before the exam. It means you do it once, the examination, the history, the procedure, whatever it is, you get your feedback on what you've missed, and then you do it again. Don't just get in this habit of saying, oh yeah, I missed those, I will definitely remember them next time. You're not going to think more clearly in the exam than outside practicing with friends. Actually prove to yourself that, yeah, I've remembered it. You might be hearing all of this and thinking that it will make you very nervous, or you might have already tried practicing with friends, or you've done OSCEs and they make you extremely nervous. I understand that, and I think you still need to just immerse yourself in it. The more you do it, the more comfortable you will get with it. You get used to doing this act. If you don't get used to it now, outside of OSCEs, in the actual OSCE, you're not going to feel calmer, you're not going to feel better, you're not going to think like, this is just one day, I can get through this. You have to think like that regardless, but if you've done a lot of practice outside of it to the point where you've gotten comfortable with your friends, it's going to be way easier doing it on the actual OSCE with strangers because it's just going to be muscle memory. You're going to have rote learned everything you need to do. You're going to be much calmer than if you hadn't practiced outside. And finally, mnemonics. Figure out the areas where you keep forgetting the same thing again and again. Even when you get told it and you practice it a second time straight away, you still miss it. Now it's time to create a mnemonic, a memory hook, something that triggers you to remember what you need to do. Sometimes these are going to be just random acronyms that you tell yourself every time I go into a room to do this technique, I need to tell myself this acronym many, many times as I'm approaching it so that I do it straight away. That will help you, that will save you with the things that you keep missing. So figure out what those are for you, create your own mnemonics, see if there are others out there, ask people if they can help you create a memory hook. I still have so much advice to go over, but like I said, I wanted to keep this short, but still get something out for the people that are coming up to OSCEs, hopefully some tips that will be useful for them. But one last thing is make sure you wash your hands on the way in and the way out, no matter what the station is, even if it's via Zoom, just show them you're pretending to wash your hands. I think that alone is already a failable thing in Sydney University. If you don't wash your hands, you fail that station, even if you do everything else perfectly. So Get in the habit of doing that every time you practice. If you still need help with something else urgently, leave a comment. I'll respond as quickly as I can. I might also put it in the next video. You can also email me. I think my email should be in the description of this video, and I will try and respond as quickly as I can. Like I said, different universities have OSCE Bibles. If you don't have the ability to find one of those with your university, then you can flick me an email and I can see if I have one from my university that I can send through to you guys. And finally, if this is the last video that you watch before you do your OSCEs, and I don't think it's necessarily the best video to watch right before OSCEs, you're probably better off watching a Geeky Medics video and trying to just rehearse the steps one more time. But if this is the last thing that you watch, know that you can do this. Almost no one ever fails these things, which is not to say that you have to be really bad to fail them. It's just to say you have a really good chance of passing it. So give yourself lots of positive self-talk and know that if you do have to redo it in another week, you'll be that much better at these techniques the next year. You're going to be so good at them, and quite frankly, I don't think it's going to come to that. Just make sure you talk yourself up and hang in there. I don't have anything else for this video, so until next time, bye-bye.